Blood pressure is controlled by a variety of cardiovascular control systems, such as the baroreceptor reflex and renin-angiotensin system, by local vascular mechanism, and stress-induced release of nitric oxide from the endothelium. We will discuss about the baroreceptors reflex mechanism. Baroreceptors are mechanoreceptors. Mechanoreceptors mean the sense organs or cells that respond to mechanical stimuli such as touch or sound. The function of the baroreceptor is to maintain systemic blood pressure at a relatively constant level, especially sudden changes as change in body position, standing from sitting position or sitting from lying position. They are spray-type nerve endings in the walls of blood vessels and heart, like carotid sinus in the internal carotid artery wall, and aortic arch receptors. From carotid sinus, the glossopharyngeal nerve carries the signals to the cardiovascular control center in the midbrain. Glossopharyngeal nerve is the ninth cranial nerve, and signals from the aortic baroreceptors travel through the vagus nerve to the cardiovascular control center in the midbrain. Primary site of termination of baroreceptor efferent fibers is nucleus tractus solitarius. Nucleus tractus solitarius is described as primary visceral sensory relay station within the brain. It receives response to stimuli from the respiratory, cardiovascular, and gastrointestinal systems. These baroreceptors we are discussing are high pressure arterial baroreceptors. There are also low pressure volume receptors which are present in atria, ventricles, and pulmonary vasculature. When blood pressure increases, a stretch in the arterial wall occurs, and that stretch in arterial wall causes the increased activity of vagal nerve, causing the inhibition of sympathetic outflow and ultimately leads to decreased heart rate and blood pressure. When blood pressure decreases, decrease the signal output from the baroreceptors, leading to increased sympathetic activity. High pressure baroreceptors are extremely effective in preventing rapid changes in blood pressure from moment to moment. But because their adaptability to prolonged changes in the blood pressure, the system is incapable of long-term regulation of arterial pressure. The low pressure baroreceptors are involved in regulation of blood volume. The blood volume determines the mean pressure throughout the system, in particular in the venous side, where most of the blood is held. Low pressure receptors have both circulatory and renal effect. They produce changes in hormone secretion and also effect on retention of salt and water, influence intake of salt and water. And the renal effects allow the receptor to change the mean pressure in the system in long term.